Hi, this is Dr. Padda, and I want to talk a little bit about Xanax and specifically benzodiazepines and why we discourage their use in pain patients. A lot of patients come to us and they're on high-dose opiates, they're on medications that are for pain, and they're also on benzodiazepines. And frequently the first words out of my mouth are, hey, we need to wean down one or the other. You should not be on both. And there's some confusion, and so patients will frequently ask me, well, my other doctor put me on this, and why are you trying to take me off? And I thought I'd do this video because I think that that question gets asked often enough that there's a better explanation that I can spend a few minutes on this video explaining better what I'm concerned about, and I can reference that for my patients. So benzodiazepines, which is things like Valium, Xanax, clonazepam, lorazepam, and even a lot of the sleep aids, a lot of the Z drugs, the zolpidem, the Ambien, and things of that nature. They work on a receptor, and it's a GABA receptor. Pain medication, which is typically things like oxycodone, hydrocodone, which people think of as Percocet, and Norco, things like oxycodone that's long-acting, or morphine, or Dilaudid, or even fentanyl, which is actually a pain medication. All of these things work on a different receptor. They work on the dopamine receptor. But when you activate both the dopamine and the GABA receptors at the same time, they cause severe respiratory depression, and they keep you from sensing that you need to breathe. And when that happens, you accumulate carbon dioxide, you stop breathing, and it's the combination that is far more deadly. It's called a synergistic risk. It's more than one by itself. Certainly if you overdose on narcotics, such as opiates that we've just discussed, you may have major complications. But usually the complications are that you get drowsy, you get pain relief, and not much bad happens unless you take a massive overdose. But if you combine it with benzodiazepines, you end up with a major complication. Other things that are benzodiazepine-like that also activate the similar receptors is alcohol. And that's why patients will sometimes use Xanax, and if they can't get Xanax, they'll do alcohol. And sometimes when patients are being detoxified off of alcohol, we'll use benzodiazepines to get them off of the alcohol. But that's not a bridge that you can live on long term. Our goal is to, usually when we're detoxifying you off of alcohol, is to convert you to something that is safer for you, that has less systemic side effects, that is not toxic to your liver, and then get you to a benzodiazepine, and then slowly get you off of the benzodiazepine. Now, there's a very significant risk of dependence and addiction with benzodiazepines that is far greater than most people recognize. It's far worse than opiates. It's far harder to get you off of a benzodiazepine than it is an opiate. There's also a secondary issue. When you are put onto benzodiazepines, you end up losing pieces of memory. You get cognitive impairment. You forget what you did. And a lot of times people, especially when they're on sleep meds, they're taking a benzodiazepine and all of a sudden they wake up the next day and they're covered in crumbs and they wonder what happened. Well, they ate last night. Or there's even been circumstances where people got into their car, drove somewhere, and totally have no recollection of it. They blacked out. And that's the issue with benzodiazepines. You completely lose pieces of memory because of those benzodiazepines. And that risk of withdrawal coming off of benzodiazepines is far greater than it is with opiates. Opiates, if you risk withdrawal, you're going to have some sympathetic symptoms. Sympathetic symptoms are things like feeling cold. They're going to be like piloerection, which is basically having goosebumps. It's going to be nausea. It's going to be vomiting. But it's rarely a seizure. And benzodiazepines, when you come off of them, you can seize. So we have to be very careful when we detoxify you. You should not take it in your own hands to suddenly say, well, I've been on Xanax for years, or 6 months, or 3 months, or even a month, and suddenly say, I'm going to come off of it tomorrow and stop. I've seen more patients have more complications going into an acute seizure and actually dying from coming off of benzodiazepines than I have off of narcotics. And the combination is definitely deadly. So when we remove somebody from benzodiazepines, it's a very slow wean. And there's a particular weaning process that we do where we come off more at the beginning than we do at the end. It can take 6 months plus to get somebody off of a benzodiazepine. You initially will move pretty fast, getting them down on their total dose, but then near the end, it's really hard to do. And there are some patients that have PTSD. They have other psychiatric issues. You physically can't wean them off. Or if you do wean them off, you have to do it over an extraordinarily long time period, and you have to have a lot of emotional support. You have a lot of re-education of their brain and think about things in a different method. There's also specific indications for severe spasticity that's not relieved in any other way, and especially for people with sphincter spasticity. Those patients with severe spasticity, that benzodiazepine may be the only thing that works. Now, certainly, we have a lot of antispasmodic drugs, but sometimes they don't work as well as benzodiazepine. And keep in mind that a lot of the sleep drugs act like benzodiazepines, especially Ambien, especially Soma and Lunesta and things like that. So keep in mind that there is an action that overlaps. And I often find that patients that take Xanax will actually use it to sleep, and that's a terrible combination. You're actually not sleeping. It's actually distorting your REM sleep altogether, and you're just forgetting that you didn't sleep. So if we've had that discussion and you have additional questions, make sure that we discuss that on your next visit. I just want to make sure that I've given enough information and you can get that information in a couple different ways, so that when you have questions or you have concerns, you can bring it up to me and we can further discuss it. Thanks.